Welcome back, everyone, for another Medvarsity Deep Dive. You know, today we're going to be diving into a condition that's actually pretty common, especially for those intensive care units. It's delirium. Have you ever heard of it?
Yeah, it's definitely something that's way more prevalent than most people realize, and it can be really scary for both the patients and their families. A lot of times people think of it as dementia, but it's actually quite a bit different.
Yeah, you're totally right. Dementia is more of a long-term thing, right? It's progressive. Delirium, on the other hand, that comes on super suddenly, and it's usually temporary. It's like a sudden disruption in
Mhm.
how your brain normally functions. It can happen to anyone, but just to give you an idea of how common it is, up to 80% of ICU patients who are on ventilators experience delirium.
Wow, that's a really big number, and it really shows us why we need to understand this condition so much better. It's not just like a little bit of confusion. It can actually have some really serious consequences.
Okay, so let's get into the specifics here. What exactly is delirium? What does it actually look like when it's happening to a patient?
Well, the main thing is that it affects the person's mental state. It affects their thinking, their awareness, their behavior. So they might be disoriented, right? Have trouble focusing, and their thinking just gets all muddled. One of the things that really sets delirium apart is that the symptoms can actually fluctuate. Like one minute, the patient might seem pretty clear-headed, and then the next, they're super confused or agitated.
Yeah, that sounds incredibly difficult to deal with,
Yeah.
both for the patient,
Yeah.
and also the medical staff who are trying to care for them.
Oh, absolutely. And that's one of the big reasons why it's so important to be able to recognize delirium really early on. If we can identify it, then we can start to figure out how to address these changing symptoms. And hopefully we can prevent things from getting even worse.
So why is delirium particularly concerning in the ICU? What makes it more than just this temporary issue with the brain?
Well, there's a really strong link between delirium and higher mortality rates for people in the ICU. Basically, this means that if you develop delirium while you're in the ICU, you have a higher risk of dying.
Oh, okay, that's alarming. What are the reasons behind that connection? Is it just the confusion itself, or are there other things at play?
It's not just the confusion, no. It's like a domino effect. Delirium can lead to longer hospital stays, and that makes patients more likely to develop complications, things like infections or even bed sores. It can even make it harder for them to get off a ventilator. So all of these things together, they contribute to that higher risk of dying.
That makes sense. So recognizing delirium early on is super important, not just for the patient's mental well-being, but for their overall health and even survival. But with all these fluctuating symptoms, it must be really hard to pinpoint, you know?
It can be, yeah. But thankfully, there are tools that healthcare professionals can use to help them identify delirium. One of the most commonly used tools is the CAM-ICU, which stands for the Confusion Assessment Method for the ICU.
Okay, that sounds pretty straightforward. How does the CAMICU work? Like, what are the red flags it's looking for?
It focuses on four main things. First, it looks at whether the changes in mental status happen really suddenly or if they fluctuate. Then they look at inattention. So can the patient focus on a task? Then they assess the patient's level of consciousness. So are they alert? Are they drowsy? Are they somewhere in between? And then finally, they look for signs of disorganized thinking.
Gotcha. Can you give an example of how they might test for disorganized thinking?
Yeah, sure. Imagine they ask the patient to draw the face of a clock if they struggle to put the numbers in the right places, or to draw the hands correctly. Well, that could be a sign of disorganized thinking. Or they might ask some seemingly simple orientation questions like, what year is it?
Right.
And if they have trouble with that, it can be an early sign of a problem.
Okay, so it's about watching their behavior and also testing their cognitive abilities in a more structured way. That makes a lot of sense.
Exactly. And using tools like the CAM-ICU can help us make sense of those confusing symptoms. It helps us find some order in the chaos. And that makes it easier to catch delirium early on.
Yeah, I'm curious. Who is most at risk for developing delirium in the ICU? Is it anyone who's critically ill? Or are there specific things that make someone more susceptible?
Well, it's not just people who are critically ill, but they are definitely more vulnerable. There are a bunch of risk factors that can make someone more likely to develop delirium. It's almost like, like all these different vulnerabilities coming together at once.
I like that. A perfect storm of vulnerabilities. So what are some of those vulnerabilities?
They can kind of be grouped into three main categories. There's the pre-existing conditions, the things related to their current illness, and then things that happen during their actual hospital stay. For example, advanced age is a big one. And if someone has pre-existing dementia, that makes them even more susceptible. As we get older, our brains just become more sensitive to these disruptions. And if you already have dementia, it's like it just adds to the problem.
Okay, so age isn't something we can really change, but it's something to be extra careful about. What about the factors that are related to their illness?
Oh, yeah, things like infections, organ dysfunction, even surgeries can increase the risk, especially major surgeries.
Yeah.
And it's not just the physical stress of the illness itself, it's also the body's inflammatory response to that stress.
So the body's already on high alert, which could make the brain more vulnerable. What about those post-admission factors? The things that happen once someone's in the hospital.
Right, so sleep deprivation is a big one. And certain medications, like opioids or benzodiazepines, even just being immobile can play a role. And here's the thing, the environment of the ICU itself can actually contribute to delirium.
Really? I mean, isn't the ICU supposed to help people heal?
It is. But it's also a very stimulating environment. You've got all these machines beeping constantly. The lights are bright. There are people coming in and out all the time. It can be really disorienting for someone who's already vulnerable. Imagine trying to rest and recover when you're constantly bombarded with noise and activity. It kind of makes sense why delirium is so common in the ICU.
Wow. I never thought of it that way. But yeah, that makes perfect sense. So we've talked about recognizing delirium, but what can we actually do about it once it happens, especially in the ICU? Is it just a waiting game? Or are there specific things we can do?
It's definitely not just a waiting game. We're learning more and more about how to prevent and manage delirium. One of the key things is to address those risk factors that we can actually change. For example, we can make sure pain is managed well. And we can try to optimize sleep as much as possible and minimize the use of medications that might contribute to delirium.
That's a good start. Anything else?
Early mobilization is another big one. Just getting patients up and moving can make a huge difference for their mental clarity. Even just sitting them up in a chair can help.
That's interesting. Why would something as simple as movement make such a difference?
Well, think about it. When you're lying in bed all day, your senses aren't really engaged. Your world gets smaller. And it's easy to lose track of time and where you are. But when you're up and moving even a little bit, your senses are engaged, you're interacting with the environment, and it helps ground you in reality.
Oh, that makes so much sense. It's like your body's reminding your brain that it's still part of the world. And I bet it helps with sleep, too.
You got it. It's all about finding those little ways to promote a sense of normalcy in the ICU, to help them stay oriented. And there's another really important piece to this whole puzzle, families.
Ah, yes, of course. Families play such a big role in a patient's recovery. How do they fit into this whole delirium thing?
They're not just visitors, you know. They're actually really important allies in the fight against delirium.
I can definitely see how that would be so helpful. But how can they help in a more concrete way?
Well, think about it. Families, they know the patient better than anyone else.
Right.
They can share those little details about their personality, their habits, what their mental state is normally like. That kind of information is so important for the healthcare team. It helps them figure out what's normal for the patient and what might actually be a sign of delirium.
Yeah, it's like having another set of eyes and ears, but ones that really know the patient inside and out.
Exactly. And families can also help to reorient the patient. Remind them of things they know. Bring in pictures or music. Just engage them in conversation. It's all about keeping them connected to their life outside the ICU.
Right. It's like building a bridge between the familiar and the unfamiliar, helping them stay grounded. So it sounds like families have a really important role to play, not just in providing emotional support, but in actually being part of the care process.
Absolutely. And I think it's important for families to remember that they can be advocates for their loved ones. If they notice any changes in mental status, even small ones, they should speak up. Don't be afraid to talk to the nurses or the doctors.
That's such a good point. Sometimes families might hesitate to say anything. You know, they don't want to be a bother. But it's always better to be safe than sorry.
I completely agree. Early detection is key when it comes to delirium. The sooner we can do something about it, the better. We can prevent those bigger problems we talked about.
This has been such an insightful conversation. Delirium is something that doesn't get talked about enough. But it's so important to understand what causes it, how to recognize it, and how to advocate for ourselves and our loved ones.
Yeah, I think the big takeaway here is that even though the ICU can be a disorienting place, there are things we can do to minimize those risks. and to support patients during a really vulnerable time.
Absolutely. It's all about working together, the healthcare team, the families, and the patients themselves, to create a healing environment that supports both physical and mental well-being.
Well said. The more we understand about delirium, the better we can care for people.
This has been another Medvarsity Deep Dive. We've learned so much about this often overlooked condition. It's amazing how just being in the hospital can affect our mental state. It's a reminder that we need to be aware of these risks and to advocate for ourselves and the people we care about.
It's all connected, you know, physical health and mental health.
Well, on that note, I want to thank you all for joining us for this Medvarsity Deep Dive. We hope you found it informative and helpful. Stay curious, stay informed, and take care.